arrived there to pay tribute to the flag at half-mast. And they're making very rapid progress towards the centre.
Hello, Joseph. Hello, Cynthia.
Hi, Mercy. Good afternoon.
Good afternoon.
I thought one was 1. I didn't know it was 2 p.m. But it's all right. I will try and stay on.
Okay, it's all right.
The Royal was already in Scotland, and I think we know Scotland staying at Balmoral.
You received the draft, the agenda that I shared with an
Yes.
Uma Ibrahim just sent an apology this morning that
Okay.
will not be able to join. So when we get to his allotted section, I'll take that.
All right, no worries. Yeah. We usually just start with welcome and introductions.
Okay.
And then after that, we introduce people to AfroPHC.
Yeah.
And then have a discussion about the region and challenges around the region.
Yeah.
Then we introduce the policy framework.
That's right.
Yeah, and then have a discussion around the policy framework, what people like, what they don't like.
Yeah.
And any recommendations they may have.
That's right.
And we ask people to volunteer for the interim task force to build their regional chapters.
Exactly.
Yeah. So I can just give people some time to join.
I hope they will.
Yeah. Let me touch base with Senkire because he's the one who's supposed to give the presentation on the policy framework.
Okay.
Yeah.
Oh, it's not Singeri.
Sorry?
I thought it was is it Sinkeri who was to give that?
Yeah, he was to give that, the call to Africa presentation.
Yeah.
Yeah. So let me just check with him. Or do you have the presentation?
No, I don't have it.
All right. If he doesn't join, then I can also.
He has the PowerPoint presentation.
Okay, let me just check with him. If he's not joining, I can make the presentation as well.
Okay.
All right. Thank you. Let's wait for the top of the hour.
Yes. Emito.
disagreement. How do we solve disagreement and dispute settlement? What do we do with our resources? How do we mobilize them? Who pays what, right? Who provides what? It's not only about money. It's also about, as I said, knowledge and technology, leadership, etc. Now, this is what the governance concept is capturing. Now, the thing is, governance is
Good afternoon, everyone.
at a national level, right? At a national level,
Joseph, I don't know, should we give a few more minutes for people to join, probably 5 minutes? Hi, Cynthia.
it is a delimited territory.
Yes, Cynthia, I couldn't hear what you were saying. Hello, Cynthia.
Hello. Hi.
Oh, hi, Cynthia. How are you? I was asking
Did
whether we
really-
should give people like 5 more minutes to join. I've posted in the
I think so.
Yeah, I've posted in the group that the meeting has started.
Okay. Yes, I've seen that. I've seen that.
Yeah.
Let's give them a few minutes, then we can start.
All right, no worries.
How are you?
I'm fine, thank you. How are you?
I'm good. I'm good. It's getting hot in Zimbabwe.
Really?
Yeah. Yes.
I would
getting hot.
think it's getting colder in the south.
No, we are just coming out of the winter and it's getting hot now. Mm.
Ah, okay. And then how long will the warm season last?
Or until maybe March next year.
Oh, that sounds good.
Yes, a very, very long summer holiday up to December. It will be raining. We're expecting rains and around November, and they go on until about March or so.
Okay. Yeah, that sounds great. Here it's cold, it's freezing. We are hoping soon we'll get out of this cold weather. We've been in it since July. So hopefully
Okay.
it should be getting warmer as well.
Okay. Where are you? Are you in Kenya or are you in Kenya?
I'm in Kenya, yes.
All right. Okay.
Yeah.
Oh, no, that's fine. Yeah, I've been there several times on East Hexagon Business, you know, the nursing college, East Central and
Yes.
Southern Africa College. Yeah, at one time
Okay.
I was leading, I was the chairperson of the faculty of research, the regional chairperson, but my term
Okay.
of office ended last year.
Oh, the next time you're here, you should let me know.
Okay, right now they've traveled to Eswatini at other things. The conferences there is at Eswatini as I speak.
Okay.
Mm-hmm.
All
I
right.
didn't. I've just been attending virtually because I had other things. I had competing issues at country level. Yeah.
All right. So I see Basira has joined us. Basira, welcome. We're just waiting for a few more. We're giving a time for a few more people to join. Then we'll start. So let's probably give it Thank you. So let's give it maybe until around 10 past. And then we'll start with those who have joined.
Daddy, today, Daddy is coffee. Again. What about
This is already again. Wait. Okay.
Daddy, I to go happy. I to go happy. How to pee? I to pee a cover.
Wait. Okay, you want to pee?
Mm.
Okay. 1-3. 1003. Junior diagnostics.
Eden, your conversation with your child is coming through. Maybe you want to mute yourself.
Come on, go inside. Enter. Hey. Go there, go there, go there. See that, don't disturb me before I.
You see, there, and I think you should mute yourself so your conversation remains within your family. Well done.
Oh, good afternoon, everyone. Welcome to the AfroPHC Western Africa chapter consultations. We received a PHCPI grant to develop a policy framework around building the Africa primary healthcare team. And as a part of that grant, and also to ensure that the voices of the primary healthcare workers around Africa who are the frontline are heard, we are carrying out chapter consultations. My name is Mercy Wanjala. I'm a family physician from Kenya and the Deputy Executive Coordinator for AfroPHC. And I would like to welcome you and hand over to our facilitators today, who are members of the AfroPHC board, Joseph Anna and Cynthia Chaiba. Over to you, Joseph.
Thank you very much, Mercy, for that opening comment. And good afternoon, everyone, or good morning, wherever you are. Welcome to the AfroPHC West Africa chapter meeting. We have about 7 of us in the room at the moment, which is very much smaller than we expected. But I think we'll just, well, I'd like to hear from the House, actually. Do we proceed or do we give some more time? This is a very small number. There's only 7 of us in the room now, and of these 7, 3 of us, Mercy, Cynthia, and myself, are already very familiar with what, and Ephraim, I can see Ephraim Sinclair too. So about 4 of us are actually members of either the executive board or the ECT. So I would like to hear from the House. Do we give our colleagues a few more minutes, or because otherwise we'll be talking to ourselves?
Yes, we should wait.
Okay. That's Ephraim Sinclair. Yeah.
Yeah, I also support that we give it a while
Yeah.
because most of the people who are here are the converted. So we know the story about
Exactly.
the AfroPHC. Let's give them a bit of time, and
Yeah.
if not, we'll proceed.
Yeah.
Thank you.
Okay.
All right. Yeah.
So it is our duty as health
Let me see if I can share something. Share the draft.
I'll show you all this in a second. Or if you're not the health professional, then start relating yourself with the health professional. Kind of official value, there is no official. These values are very contextual, but it's hard to come up when a context is so important. So let's make sure that we are understanding that when we're looking at elements of this graph and how they're related, we are clearly understanding that a lot of these are beyond the traditional health realm, and that we need to become really aware on what are the governance mechanisms that are playing a role in changing, helping, reversing. Like, because when we think of global, already, let's just call this global. Let's just call it. Visual or such a prominent role in the public, but definitely are playing a role in how we reach the collective goals and how decision making process happens. And this is just for health, right? If we're to add the environment here, messier, if we're to add trade here, messier, if we're to add economy here, messy. But think of the different actors that are playing a role in the global level, like the private sector. And let's just throw an example out there, right? And think of the role that the private sector is a different field, like played a role in how they shape the response to a common goal, COVID, right? Pfizer, biotech, Moderna, many other biotech companies play a huge role here. Then you have countries themselves, right, in their policies, right, in their vision and how they shape the COVID. Have science organizations, like the bodies, have others that are such as banks, like IMF, that are not necessarily the United Nations bodies, but are financing the processes, not just how things are implemented, but also how the decisions are made and implemented, how the decision making process is acted, how the role of philanthropy, that topic category. Other graphs, and then you see that all these other are cultures. When you apply again the determinant lens, the governance system, you get very complex governance. Understand, and from one of your readings, this is more or less what we have pointed to this graph. Reading how the global environmental agenda policy guide, in which it is written for health professionals, but also for people that are working. Trying to say, okay, what are the governance mechanisms that we have made up in silos that now need to come together in order to come better to our common goal of planetary health? Now, some of you might know the list, what these initials mean. I'm just going to run you some of them, because some of them might be.
I think we'll just probably just give another 5 minutes and then we'll start. Because our number I see has increased by 1, so we're now 8. Let's see. Surprise. Okay, it's 2:25 now, and I think we should make a start. if I have the concordance of the house, those of us in the, can we make a start? Can we just start?
Yeah, sure. So Joseph, go ahead.
Thank you. Right. Welcome again, everyone who is in the house. So, well, our number is now 9 of us, so we're making some progress. Let me just share the agenda. No, it's not. It's not. Sorry. That's not it. I was trying to see if I can get the agenda to share. There we go. Right here. Can you see my screen, please?
Yes, we can see.
We can.
Yeah, thank you. So that's just the agenda we're going to follow for this meeting. We'll try and make it as short as possible because we know everybody is very busy. I suspect that's why we're not having a good attendance at the beginning. Maybe our colleagues will join us later. And so there will be some introductions of those of us in the room at the moment, and that will be followed by introduction to AfroPHC to be delivered by Mercy Wenjala. And then there will be the chapter discussions on what are the challenges of primary health care in the West Africa sub-region. And Cynthia, would you be happy to take that for us, please? Sorry for the short notice.
No, that's okay.
Okay, thank you. And then that will be followed by a review of the AfroPHC policy framework document. The document that Mercy referred to at the beginning of when she made her opening remark. Sinkere Kumi will take us on that review. It's a very important document, so I hope that we'll have some more people in the room and we'll come to discuss that. And then there will be discussions on how to take AfroPHC forward. And I and Mercy would be championing that. So that's the agenda that we'll be going through. And without further ado, can I ask those of us in the room to begin to introduce ourselves, please, and beginning with, let me start. I'm a medical doctor, and I lead the Center for Clinical Governance Research and Patient Safety based in Calabar, Nigeria. I'm a member of the executive board of AfroPHC and the chapter lead for the West Africa sub-region. Mercy, you had introduced yourself, so can we go to Cynthia, please?
Okay. Who is starting, Mercy or myself?
No, Cynthia, sorry. Mercy had introduced herself already, so. Cynthia, you go ahead, please.
Okay. All right. Greetings to everybody. I'm Cynthia Chaiba from Zimbabwe. I'm a member of the executive board of AfroPHC. I'm actually a nurse midwife, a nurse consultant, and I teach. I'm a senior lecturer in the Department of Nursing and Midwifery Sciences in the Faculty of Medicine in Zimbabwe at one of the universities. I'm really proud to be in this forum because I think together we'll take this forum to greater heights and improve the livelihoods of people in the rural settings. Welcome, everybody. I also coordinate the chapter activities for the Southern African region together with the Jamie Koloti. Thank you.
Thank you very much. Next on my list would be Sinkere Ephraim.
Hi, I'm Sinchiri Ifrikumi. I'm a registered nurse from Ghana and also research lead for AfroPHC and a member of executive committee. Executive committee. Thank you.
Thank you very much. I see Austin. It's just gone off my screen at the moment. Austin Ashford.
Yeah, hi everyone. Good afternoon, good morning, wherever you find yourself. Yes, Austin Ashford. I'm from Ghana. I'm a physician assistant and I work with UNAIDS. Thank you very much.
Thank you very much. I can see Arit Anna.
Hello, everyone. My name is Aretana. I'm a retired public health nutritionist who used to work with the NHS, but now working with HRI Global in Calabar, Nigeria. I am a new member. Thank you.
Thank you very much. Let me stop sharing so I can see all the names in the room. Yeah, we're 10 of us now, so that's good. I can see who that. Basira Lawal.
Good day, everyone. I am Basira Kankia Lawal. I am a pharmacist in academia working as a lecturer at the Department of Clinical Pharmacy and Pharmacy Management, Kaduna State University.
Thank you very much. You're welcome.
Thank you.
Isim Hanan Idehen. So, sorry if I pronounce your name wrongly. I'm sorry about that. But,
I am Isim Idehen, medical officer, University of Cross River State Medical Center, Gubra, Nigeria.
You're welcome. Idehen. Who's I can see. I think that's the 10 of us. I hope I haven't missed out anybody else.
There's
Peter.
Peter.
That's Mfonobang Ekbo. Are you here? Mfonobang Ekbo. Okay. That's clearly.
Joseph, we also have Peter.
Yes,
Yeah.
Peter has just joined. You're welcome, Peter.
Thank you very much. Yeah, I'm actually just curious what the West African board is doing. I'm attending the East African one, and I do that on behalf of the European Forum of Primary Care that has a twinning relationship with AfroPHC, and I'm a member of the working party in Holland that supports very much primary medicine development, education, and rural medical care in Africa. So that's why I try to keep up with the developments that are, and that's difficult because there's so many meetings and so many things that, but that's hopeful. So I'm pretty happy, although the attendance may be low now, but I think that will increase.
To pick up, yeah, I think so too. Thank you very much, Peter, for coming.
Yeah, thank you.
Thank you. Akaninya no boat. Akaninya no boat. I don't know if your mic is muted. Let's see. Akaninya, if you can hear us, you can just a short introduction of yourself, please. Well, we can't hear him. There's Dr. Kukunte just joined. Dr. Kukunte, please. Brief introduction of yourself. Dr. Kukunte. Your mic is muted. Okay, good.
Yeah,
Yes.
hello, good afternoon.
Good afternoon.
Actually, my name is Kwabena Ahude. So Dr. Kupuntu Senior is my nickname.
Okay.
Yeah. I am from Ghana. And I've worked in the field of HIV and AIDS for very close to 20 years. And I'm a management consultant now, privately, and still in the part-timely doing some health-related work administratively. At one time in 2017, I was the executive director for the network of persons living with HIV in Liberia. It was for a year we were implementing the Global Fund funded project for key population. And we had to take that project through. So, well, that's what I can say for now.
Thank you very much. Very kind.
You're welcome.
Yeah. Mfonobong Ekbo, please. I think it's you left. You and Kanina. Your mic is muted. Mfonobong Ekbo, your mic is muted. If you can unmute yourself and give us a short introduction of yourself.
Hi, everyone.
Hi.
Good afternoon. I previously sent a message on the chat box because I'm in a noisy place.
Okay.
So my
Okay.
my name is Mfonobong Ekpo. I'm a pharmacist practicing in Nigeria. I'm here to learn and to share what's being done on the platform. Thank you for having me.
Thank you very much for coming. Could I call on Akaniyan Obot again, if you can hear us? Okay, if you can't, we'll go to the next item on the agenda. May I request Mercy Wanjala, please, the executive coordinator of AfroPHC, to give us her talk on the introduction to AfroPHC. Thank you.
Thank you very much, Joseph. And thank you very much, everyone, for joining us today. Apologies for anyone who needed French translation. We do not have French translation today, but we usually have that. So hopefully we'll be able to go on together and have the discussion in English. In case you have any difficulty, you can also just speak up or type in the chat. So as I had mentioned earlier, AfroPHC received the PHCPI grant to develop a policy framework around building the primary healthcare team for universal health coverage in Africa. And that is why we are here today, to just know more about AfroPHC, what we are doing, and also what the chapter consultations are about. As for the agenda, Joseph has already gone through that. So I'll just start off with a bit of background of where AfroPHC started. It started off during the Wonka Africa conference in June 2019 in Kampala, whereby during a workshop, there was a suggestion of forming an Africa forum, like the European Forum for Primary Care, that Peter, who is with us here today, is a part of. And after that, the discussions went on in Nairobi during the AfriPen August 2019 conference, where a team members of consisting of doctors, nurses, occupational therapists, among other people, came together and had a discussion and decided this is something they want to take forward together. Then in September 2019, AfroPHC presented a proposal in response to the UHC declaration of September 2019 that was made. So AfroPHC submitted a proposal of why AfroPHC should be formed, and also garnered the support of organizations like Wonka Africa, WHO, Afro and AMREF, and Prima Famed, amongst others. So this is what the initial pitch for the formation of Africa Forum for Primary Healthcare looked like. We as healthcare workers on the front lines of primary care services in health systems of Africa and supporters of the primary healthcare approach are committed to achieving universal health coverage in Africa. However, it is very easy for UHC to be seen as a financial solution without the required reform in primary care service delivery. The centrality of PHC to UHC efforts may become lip service, especially when frontline primary care worker voices are ignored in Africa. So you can see the pitch was around service delivery and the primary healthcare worker, who oftentimes is forgotten when people are making decisions around primary healthcare and how primary healthcare is a driver of universal health coverage. So we plan to bring together the leadership of all health workers at the coalface in African primary healthcare and ensure that we all have a voice in policy on primary care and primary healthcare in Africa. We hope to develop an Africa Forum for Primary Healthcare as the voice of primary care and the primary healthcare team and its supporters sharing and supporting each other in advocating for PHC. So these are the statements around which AfroPHC was formed. And later on, the second statement formed a big part of the mission statement for AfroPHC. Moving forward in 2020, they started off with online AfroPHC workshops with introductions of the people who from different countries who wanted to be part of and form AfroPHC. After this, there was a launch workshop of AfroPHC. It was the first joint exercise in September of 2020, where people just got to know each other and then emerged with a statement around what AfroPHC is and what the principles of AfroPHC are, which center around being primary healthcare being people-centered, with primary healthcare human resources, capacity development, teamwork, inclusive PHC leadership, and advocacy as key. And these principles still are a cornerstone of AfroPHC and what AfroPHC does, as we will see later on in the presentation. Later on in December, there was an AfroPHC for universal healthcare coverage in Africa, and there were reflections on the issues affecting primary healthcare in Africa. And then also during the APN symposium in November, there were further discussions on how to take AfroPHC forward. So with the launch that came now last year in April with an annual general meeting of all the members that had registered as AfroPHC members, there was a vote to elect an executive board, a 9-person executive board, and these were the names of the original board. And as you can see, they were coming from diverse backgrounds and also diverse in terms of the countries, from South Africa to Zimbabwe to Uganda to Nigeria to Sudan. And then later on, to enhance the functions of the board, we had Champion Nyoni and Marie-Claire Ngaren Tolu being co-opted into the board. Tolu to help with the NCD's area and also connecting with NCD capacity building. Marie-Claire to help with connecting with the youth through the Youth Hub, and Champion Nyoni to help with the interprofessional network connection. So since then, there's been a lot of stakeholder engagement with AfroPHC, having 31 supporting organizations with an advisory board set up, and engagements with the WHO Civil Society Commission, and also the formation of the Youth Hub to engage youth-led health organizations and also youth-led student organizations. Part of what we are currently doing as a part of our mission and vision is policy workshops, which occur every second Tuesday of the month. We're having one next Tuesday, but one on the role of women in primary healthcare. So far we've had quite a number of workshops. In 2021, we had about 10 workshops on the topics that you can see there. And in 2022, we've had so far 8 workshops on various topics: pharmacists in PHC, oral health, One Health and the environment, models for primary healthcare. And the importance of these policy workshops has been that they have contributed a lot to the policy framework that we have now developed. So it has the voices of the primary healthcare workers from around Africa, and it has their input, and it has an African context and an African take on primary healthcare as it is now. So going forward, we are also engaging in training, because as AfroPHC started out, capacity building was an important part of our key principles. And part of the training involves the leadership and management and governance course for health system strengthening course, which is in partnership with AMREF. We had in 2021 792 engaged, with 18 completing the course, but over time more have been completing the course, going almost up to 100. And in 2022 we engaged 372 healthcare workers, even health economists, people from different backgrounds but interested in health leadership. And we have a discussion group every second Tuesday of the month. The policy workshops are every third Tuesday. Sorry about that. So we are now in the seventh module on we are now on the 7th module. Then with more on capacity building on the clinical side, we are doing clinical CPDs 1 to 2 p.m. GMT every Thursday of every week. So even yesterday we had one. So that is something we are continuing with. And if you go to our website, you can also check and register to be part of it. It is in partnership with the WCA World Continuing Education Alliance, and we usually have 500 plus people attending. Also, as part of capacity building, we are in the process of developing a curriculum framework for a 2-year online clinical postgraduate diploma in family medicine for different people like clinical officers, nurses, and also general practitioners or medical officers, as we call them here in Africa, who would like to practice family medicine or know more about family medicine so that they can support the primary healthcare team. We are also engaging in research as part of the AfroPHC Research Mentorship Program. We had 298 people interested at the beginning of the year who enrolled for the research program, and also the research meetings where we are building capacity around primary healthcare research from an African perspective, and also mentoring students who want to do masters and PhD research. So we have 19 researchers who submitted concept notes and are right now in the process of being matched with mentors for mentorship. So the meetings occur 12 to 2 p.m. of the first Tuesday every month. So we had one this Tuesday. And also, as part of AfroPHC engaging in research, we are part of a coalition that has received a grant from the Wellcome Trust to build an African population cohort consortium. And we are in the process of doing that. We'll receive more updates as we go along. In terms of communication, we use our website to post any kinds of meetings that we are doing, trainings, amongst other activities, and other interesting articles around primary healthcare. If you go to afrophc.org, you can learn more about that and all the programs that I've mentioned. We have a monthly newsletter that is usually sent via email. We have over 1,000 members. I think right now we are at 1,600 plus members, growing conversations through the chapter groups which we have formed on WhatsApp. On social media, we are also on Facebook, Twitter, YouTube, and LinkedIn. So if you search for AfroPHC, you will find us on those platforms, and you can see more of what we are doing. In terms of administration, we have an executive coordinator who currently is Prof. Shabir Musa, and I am his deputy. We have a strategic and operational plan, which is available on our website so that you can see how we are planning and doing our activities. Membership has actually risen recently to up 1,600 from over 40 countries across Africa, and diverse healthcare workers, and also people who are interested in policy like health economists who are interested in primary healthcare policy are also part of our membership. And we are a registered non-profit organization in South Africa. To support the work of the executive coordinator, we have the executive coordination team, people like Jamie Colity, who was not able to be with us today, who leads the clinical program and mentorship. We have Eli Bajo leading the CPD. We have Senkire Komiatijani leading the AfroPHC mentorship. We have Marie Claire with the Youth Hub. We have our communications officer, Innocent, and fundraising, Rawia. So coming to what brought us here today, we have the PHCPI micro grant, which we received as part of as a grant to develop the policy framework. The policy framework is on our website. It's a document that you can, it's a Google document that you can read and also comment on that. And the goal of this is to build primary healthcare teams for universal healthcare in Africa, focusing on effectiveness of the primary healthcare team, especially in the African context. So the chapter consultations are part of a project that we started as for the formation of chapters so that we can engage better at regional level with different members. And we have taken that up to also include getting feedback on the policy framework, on what people think about the framework. If there's anything that is missing, if there's anything that you don't like, you're also free to comment during this consultation. So the chapter consultation basically have this order where we look at the challenges of primary healthcare within the region like West Africa. We will look at the draft policy framework, we'll review it and see what we like, what we don't like and such. And then how do we take AfroPHC forward? And also, would anyone in the meeting or in the group like to be an interim regional task team member to support Joseph Anna, who is the team lead in taking things within the region forward? And with that, I thank you, and I'll give room opportunity for any questions you might have around AfroPHC, around the grant, or around, anything to do with the consultations. Thank you. Over to you, Joseph.
Yeah, thank you very much, Mercy, for that description of what AfroPHC has been doing since it was formed in 2019. Colleagues, you can see that it's been a very busy association that we have. And once again, you're welcome to this very important meeting. As Mercy has mentioned, the draft policy document that presents AfroPHC's view to African leaders about what should happen to primary health care has been prepared. This consultation is meant to give us an opportunity as members of AfroPHC to make our contributions, so that when the document is finalized, we can feel confident that it represents the views of PHC stakeholders in every region of our continent. So this is a very, very important meeting. Mercy, thank you very much for that presentation. And the floor is open for any questions for Mercy, please. Yes, Austin.
Yes, thank you very much for the opportunity. And I also appreciate what Mercy has shared with us. It's comprehensive enough, though we are not part of the initial meeting that has been organized. You know, when you go to most of the African countries, they have their regulatory authorities for the professionals. We have the Medical and Dental Council, we have the Nursing and Midwifery Councils, and other allied health science council. Is there any way that we can link up with these councils so that whatever CPD that one will participate, so that person can use it to register or to renew his or her license in their home country, because I might participate in the AfroPHC CPD, but it will not reflect in my country when I submitted the topic to the Medical and Dental Council or Allah Health Council for renewal of licenses. So just want to find out, is it possible? Thank you, over.
Thank you. So you are asking if CPD certificates can be given when AfroPHC organizes the training. Merci.
Thank you very much, and thank you for that question. So once you register with the WCA, the WCA app, and you register for the CPD, you register for the webinar. After you've gone through the webinar, you will actually be issued with a certificate of completion or a certificate to show that you attended that webinar, a certificate with points.
Thank you.
So you should not worry about that. The CPD come with points and a certificate once you register.
Right.
I'll put the link on the chat.
Answers your question, I hope.
Yeah, I think I have to. I want to add that because I'm a nurse in Ghana and I use AfroPHC CPD to renew my PIN. Yeah, so it's acceptable in Ghana.
Right. I'm sure it will be acceptable in where Austin is located as well.
Hello.
Hello. Austin, were you going to say something?
Yes, I'm also in Ghana, but my issue is I'm with the Medical and Dental Council. Yes, I'm saying that I'm also in Ghana, but my issue, I'm with Medical and Dental Council. Yes, so presenting such a CPD topics or point to them, they don't accept it unless you have been registered with them. So that is my issue. If it's possible that we can link up with other boards.
I see what you mean. You are suggesting that the AfroPHC should register with these regulatory boards in the various countries. Yeah.
Thank you for that, Austin. It's a valid recommendation, but the WCA is an internationally recognized CPD provider. So it might now rest with you to lobby for your local council to accept that, because a lot of councils around the world accept WCA as a valid CPD provider. So be now down to you at country level to lobby for them to accept it, because it's an acceptable international CPD provider. So maybe you might just have to engage them and let them know that at country level.
Exactly. That's the point, because from my experience in Nigeria, that's exactly what happens as well. The various regulatory bodies would recognize CPD depending on what they know about the CPD provider itself. Okay. Right. Any other questions, please, for Mercy's presentation, which was quite comprehensive and shows how active the association has been. No further hands are up. Let me see. I'm glad to say that our number has increased to 14, so we're making progress. And if there are no other questions, we'll go to the next item on the agenda, because we're short of time now. And Cynthia would lead this item, but before she takes over, can I just call on our colleagues who are actually in practice in West Africa, that this is an opportunity for us in West Africa to make a contribution to the draft policy document. It's an opportunity for us to highlight the challenges that we recognize as individuals to the practice of primary healthcare in our countries. So please, let's be a bit more interactive and speak up and make this session very useful. Cynthia, over to you, please.
Okay, thank you very much, Joseph. May I say greetings to everybody again. As already, Joseph Anna has already mentioned that we need to share the challenges that we are facing, PHC challenges that we are facing in the region. And today, as we are discussing the West Africa chapter, we give most of the opportunity to those in West Africa, but that does not limit others from other countries, because we still need to share the challenges, which I believe somehow or other are universal. So the discussion today is centered around sharing the challenges of primary health care in the region. So I'm opening the floor for anyone to share with us the challenges that we are facing in the region in relation to primary health care. Open for discussion. West Africa is your opportunity. Other people from other countries, please, we also would like to know what the challenges are that you are facing. Thank you. We're open for discussion now.
Yeah, our colleagues from, I think we have people from Ghana and from Nigeria here. Please, can we hear from you? Yes, I can hear you, but I can see your hand is up. Sorry, Cynthia.
Yeah. Okay. Afternoon, everybody from Nigeria. One of a few challenges that I have come across practicing in primary health center, not as a medical doctor, but as an NGO that has an office in the primary health center, is the poor number of trained staff in the health facility, which becomes a problem. Mostly in the primary health center, we don't have doctors that do come around, or we don't have doctors, even if we have community health workers. And doctors, medical doctors are very important in primary health centers. So, and the communities, many a times they don't trust the community health workers that are there, except there is a medical doctor that is assigned to that primary health center. That's when the people kind of have hope in that primary health center. And another thing that I equally observe is that most of the primary health centers are neglected in Africa as a country, I mean as a whole, because many a times the community people, they refuse to take responsibility of ensuring that it works. They just look at primary health center as being only the government's responsibility to make it work. And they kind of not have interest in the primary health center, the governance of that primary health center, the service delivery, and every other thing. So when the community are not interested in the primary health center, how it functions, many a times it doesn't really work well. So the community members, they also have to take part, they also have to have a part to play to ensure that primary health centers, they work effectively. And another aspect of it was the aspect of accountability, which we must kind of take cognizance of. Many primary health centers, the workers, the community health workers that are there are not accountable. Even if they are trained, of which that's another aspect I will look at later. Like the way the primary health center I was opportune to work for over many years, the pharmacies, they were once my NGO or my CSO, Okana West Community Health, the Base Health Initiative. But once we gather money and buy drugs to support them to work effectively, the pharmacist that was assigned there, at the end of the day, will end up doing away with the drugs that was meant for the clients and selling it behind our back and making extra money, for himself. So there have to be a mechanism of which, if something is assigned to this primary center, they have to be accountable for those things, mostly drugs. Because if the community members go to the health centers and there are no drugs, they become discouraged. I mean, they can't, or they don't want to go there again. And the other aspect also is that the community health workers, they need to be trained, maybe quarterly. I see a situation that we can maybe say a quarterly training for them to just build their capacity, because many of these guys, the primary center I equally worked with, there were some of them that were not up to date with the current service delivery. And many of them, you see, sometimes when they post them to that, when they post them to primary health centers, many of them lobby. They don't want to go to the rural community. They want to go to the urban center, primary health center, which we are not even looking at that aspect of it. We are looking at the ones at the rural community. So the people that are not kind of really trained or abreast with the current service delivery mechanisms are the ones that are being posted to primary health centers in the rural community. So there are so many, these are some of the things I have seen. I've mentioned about 4, of which we have to take cognizance of. Thank you.
Thank you very much. I think you brought in very, very critical issues that really are affecting. I'm sure most of the countries in the region are also experiencing similar, challenges. We'll invite somebody else again to share with us challenges that they are facing in the region in relation to primary health care. Ghana, Nigeria, which are the other countries? Please, let's share, let's hear what challenges we are facing in our different regions.
There's an Erasmus hand is up.
Okay. Okay, yes, Erasmus. Erasmus, go ahead.
Erasmus, your mic is muted. Can you unmute yourself and talk, please? Looks like you cannot hear us. Erasmus Agongo, your mic is muted. If you can unmute and talk, please. Looks like you cannot hear us.
Maybe you can type out your challenges on the chat.
Yeah,
if you are unable to.
Exactly.
Yes. In the interest of time, while he's organizing himself, we will entertain the comments from other members who are here. Even beyond West Africa, let's hear what challenges we are facing, because we are a region and we need to harmonize these things and approach them in a united front.
Yeah. Erasmus, your hand is up. Can you unmute?
Yes, it's still
unmute
up.
yourself? Unmute yourself and talk, please. Your mic is muted. I don't think you can hear us now. Anybody else? Somebody else? No other hand is up.
I see no hand is up. That is up.
Hello.
But anyone can speak.
Hi, Erasmus. Good.
Yeah, hello. Sorry. Yes. The problem with primary health care generally is the fact that policies are beginning to be formed, but investment for primary health care is not given the due attention. Simply because from history, we have been used to the institution-based care delivery, mainly hospitals. So therefore, people sometimes still think that primary health care is inferior to hospital care. And that is a major challenge. Government begin to realize it, to say that, oh, we want to promote primary health care. But then you see them go on building hospitals when health centers and clinics are actually needed. So they invest heavily in construction of hospitals without the supported primary healthcare network of health centers and clinics. That's one major factor. Because the investment is so low, some of them actually are not well equipped. And that also discourages people from going to those places. Hence the bypass phenomenon that we see often in these places. In Ghana, we have tried to promote primary health care, and there have been a lot of advances in that. But still, if you compare the investment in terms of providing facilities and infrastructure, you see that primary healthcare level is very low. So we are now trying to find a way of supporting, building them into networks so that they will be able to provide integrated quality care, which can be attractive to service providers. I mean, to our clients. That is one. The other point is leadership. Leadership in the sense that if you don't have very good local health managers who also believe in primary health care, they won't provide the necessary supervision. They won't be able to engage the communities in the appropriate way for them to see that primary health care is actually the way to go to meet their immediate health needs. So some of these are the key factors. We, the health professional, actually need to be convinced first. I know a lot of health professionals feel that it's inferior to hospital care, which is rather unfortunate. Over.
Thank you. Thank you very much. I think he has brought a very important issue of equity in terms of provision of services between urban settings and rural settings. And he has also brought in a very important area that has to do with leadership. May we have another presenter, please, or another person to share with us some of the challenges?
There are no more hands up, so
I think
we will
looks like
summarize
yes.
summarize that particular.
Okay. Now, thank you very much for the contributions that were brought forward. And as we move on, when you look at the framework, the highlights of the framework, I think some of these things, these are the things that we should really highlight in one way or another in the framework. If my memory serves me well, there were quite a number of issues that were touched. Among them is the issue of shortage of staff, and sometimes, especially critical staff in the primary healthcare setting, investment into primary healthcare, equity, non-provision of equity in terms of healthcare delivery systems between urban settings and the rural health settings, and issues of leadership. I may have left some of them, but those are the key areas that were brought out, which are very, very critical. And I'm sure coming from Zimbabwe, we somehow or other, we share the same challenges. Thank you very much. Over to you, Joseph Anna.
Thank you very much, Cynthia. Thanks a lot. That's very helpful. And thanks also to those who asked questions. You will see as we go to the next segment of the next item on the agenda that the draft document has tried to cover all those areas that have been mentioned so far, from leadership to community involvement to accountability, continuing professional development and training, and investment. You will see from the draft that we're going to listen to next that these areas have all been covered. So I would urge us to listen very carefully to the next presentation, which is from Ephraim Sinkere, about the draft policy document. that AfroPHC is preparing, from which we've also got this grant. So Ephraim Sinkera, please, can we move on to your presentation? Thank you.
Hi, can you see my PPT?
Yeah, I can see your slide.
Okay.
I hope others can see it too.
Okay.
Yes, we can.
Yeah, welcome everyone. I would just like to present a PowerPoint that summarizes the AfroPHC drug policy framework and the AfroPHC call to Africa. I'll start with the background. The framework pay attention to African health professionals and also identify African challenges and opportunities, and as well as it consider global primary healthcare milestones. Now, the key element of the policy framework, it includes the primary healthcare workforce, primary healthcare resources, and primary healthcare systems. So with that, we will dive into the key elements one by one. Now, the primary healthcare workforce, the framework call for strengthening human resource for primary healthcare. We call on Africa to build a larger, better trained primary healthcare workforce with more opportunities, educational, financial, and clinical, and greater resources to enable primary healthcare and universal health coverage. It also we also call to build the team with tax sharing and supportive supervision. That is, we call on Africa to acknowledge the burden on all cadres in primary healthcare and embrace interdisciplinary teamwork with a mix of all health professionals, using respectful tax sharing and supportive supervision for achieving primary healthcare and universal healthcare in Africa. Also, to build distributed leadership, we call on Africa to embrace distributed leadership practices and education for its amongst all primary healthcare workers and managers to achieve primary healthcare and universal healthcare in Africa. We also call to build clinical governance. We call on Africa to embrace the important role of postgraduate trained family doctors in decentralized primary care setting to support clinical governance, coordinated care, and efficient referrals to achieve primary health care and universal health coverage in Africa. Also, to professionalize community health workers, we call on Africa to standardize, professionalize, and decently remunerate community healthcare workers that are strongly integrated with primary healthcare team, and furthermore to aspire to target one community health worker per 1,000 persons by 2040 to achieve primary healthcare and universal health coverage in Africa. Also, to manage human resource better, we call on Africa to clarify and harmonize primary healthcare workforce nomenclature for the different categories and disciplines in primary healthcare, and to then embark on labor market analysis in primary healthcare, including public and private, and specify primary healthcare human resource for health policies and strategic plans to scale up the primary healthcare health workforce by 2025 to achieve primary healthcare and universal health coverage in Africa. We also call to develop human resource better. We call on Africa to implement a robust education and credentialing infrastructure for developing a competent workforce dedicated to delivering comprehensive primary healthcare services necessary to achieve universal health coverage in Africa. Now, primary healthcare resources. The policy call to review political and funding action for primary healthcare as investment. We call on Africa to regard health as an investment and to leverage political goodwill for action on primary healthcare and universal healthcare universal health coverage by defining primary health care in budget terms, ring-fencing the financing of primary health care and committing to at least 2% of their GDP on primary health care for universal health coverage in Africa. We also call to fight for global solidarity action on primary healthcare funding pools. We call on the world to re-examine global social solidarity on primary healthcare and strengthen contribution to primary healthcare for universal health coverage in Africa as priority. Starting with high-income countries, increasing donor aid to 2% of their health spend, and donor aid fund allocated 30% to an African Union funding pool for integrated primary health care and universal health coverage in Africa by 2030. We also call to manage pooled funds with strategic purchasing. We call on Africa to work towards better funded single pools for universal health coverage funding, prioritizing strategic purchasing for primary health care with standard and transparent contracting of both private and both public and private providers in empowered, decentralized units of primary health care for universal health care in Africa. It also called for reform primary health care payments with blended capitation. We call on Africa to embrace simple national contracting of primary health care teams with mixed or blended capitation models, including capitation, fee for service, and performance payments to achieve holistic and responsive primary health care and universal health coverage in Africa. Now, primary health care systems. The primary call for Africa to embrace the biopsychosocial spiritual approach for primary health care. That is, we call on Africa to embrace the discipline of family medicine with its biopsychosocial spiritual approach to achieving primary health care and universal health coverage in Africa. That is personalized, comprehensive, continuous, and coordinated in line with global standards. It also envisions comprehensive person, family, and people-centered primary health care. We call on Africa to embrace primary health care defined by WHO as an essential level of care that needs to be responsive, person, family, and people-centered, and covers the full spectrum of care within the paradigm of One Health for primary health care and universal health care in Africa. It also calls for health in all policies for robust primary health care. We call on Africa to prioritize primary health care as the foundation for universal health coverage, making health in all policies and integrating environmental public health approach to decentralized government, strengthen the role of primary health care facilities with flexible models of non-heretical interdisciplinary teams, and creating integrated care models of public health service delivery of primary health care and universal health coverage in Africa. It also called to build quality in primary health care. We call on Africa to embrace the culture of quality and patient safety with strong teamwork, and to measure and monitor performance to achieve quality primary health care and universal health coverage in Africa. It's also called to build the district health system. We call on Africa to place their trust in their frontline primary health care workers with decentralization of resources and locus of control to bottom-up units of care, together with robust management function to deliver on agreed upon results and operational accountability to implement primary health care and universal health coverage in Africa. It also called to in panel define population to a defined team. We call on Africa to embrace the strategy of empowerment of a defined population and linking them to a defined, fully staffed and equipped primary health care team as a foundational step to achieving primary health care and universal health coverage in Africa. It also calls to develop community-oriented primary health care for Africa. We call on Africa to embrace community-oriented primary care in community practice of 100,000 by 2025 and aspire to community practice of 10,000 for achieving primary health care and universal health coverage in Africa by 2040. It also calls for the blueprint for rural and marginalized health. We call on Africa to embrace the blueprint for rural health and rural proof of all health policies to support rural and marginalized primary health care comprehensively, especially creating step-ladder entry requirements for educational institutions and rural and marginalized students immersion for the full primary healthcare team to achieve primary healthcare and universal health coverage in Africa. It also called for us, it's also called to innovate e-health that is patient and user-friendly. We call on Africa to embrace the variety of e-health solutions for primary health care by ensuring that sustainable national e-health strategies are supported by accessible infrastructure, interoperability, and user-friendly design that enable the primary healthcare team and patient population to enhance quality and support new model of care in primary healthcare, universal health coverage in Africa. Now the call. We call on Africa to empower an effective primary healthcare team to achieve primary healthcare and universal health coverage in Africa. We, as the African Forum for Primary Healthcare, commit to educating and empowering our members to support this goal in any way we can. Thank you.
Thank you very much, Cynthia, for taking us through that very summarized presentation on the draft policy document. I don't know how many of us have had the opportunity of reading the full document that was circulated with the notice for this meeting. If you have, you would see that it's very comprehensive, and it's covered most of the, in fact, it covered all of the challenges that were mentioned in the previous segment, whether it's on issue of staffing, community engagement, accountability by PHC workers, continuous CPD for PHC workers, community health workers, and issue of making the rural areas as attractive as the urban areas for community health workers to accede to their postings, and the issue of investment, ring-fenced for PHC, promoting integrated comprehensive care that links PHC with the other tiers of care, whether it's secondary or tertiary. The issue of leadership, which is very important, and not just leadership, but continuous supervision and encouraging the PHC workers to embark on continuous improvement, and the issue of continuous education and audits and quality of this of PHC. So it's very comprehensive. It's the issue of e-health, taking PHC in Africa to the bringing it forward to the 21st century with the advent of the internet and the electronic the format of information sharing and use. So it's a very comprehensive document. But as we said before, it is absolutely crucial that this meeting we're having, and beyond this, gives those of us in West Africa an opportunity to make an input into this. It's still a draft. The document has undergone a number of iterations to get it to where we are now. But the process is not complete. The process will be completed later on in the year. There are other steps that to be taken, but this is the time for us to make our input so that when this continent-wide document is completed, we do not feel that our region was left out. Every region in our continent should feel that they have an opinion about how PHC should be shaped for the benefit of all of us in the continent. So once again, thank you very much, Nkere, for that. Can we take comments or questions based on Nkere's presentation on the call actions of AfroPHC to the leadership of our continent? Question time, please, for Nkere. Questions, please. Hello? Any comments, any questions? I want to encourage us, please, to make some contributions, whether in form of a question or a comment, or even if you think it's you understood everything, just indicate. You can also put some comments on the chat column if you don't want to speak. I can see that Mfonobon has a chat comment and it says, thank you very much for the presentation. Good. Would like to have some feedback from others in the room. It's very important. Okay, no hands are up, but I want to say you have copies of the draft document, which includes all these the various calls that Nkere has presented to us. You have the copy of the draft document in the notice for this meeting. We will encourage all of us to go through the document. It's very easy to read through. Once you start, you find that you want to complete reading through the whole document. And if you have comments to make, the document is still in a draft form. Can you submit it to AfroPHC platform? There's a section there where you can make your comments and submit it to the executive board and the executive coordination team so that your views can be considered at the further iterations of this discussion of the draft. We want to make sure that at the end, when the draft policy is ready, everybody's opinion and views has been taken into consideration so that when it is now presented to our leaders across the continent, we would expect action to be taken, right?
Yeah, good afternoon. Yeah, conference no. Almost not check for January. Almost not check for January. Any package in almost January.
Somebody is
around late January.
Nkere, is it you who are talking? Right. At this point, I want to invite Messi. Are you still with us? To lead the next segment, which was on the next steps for this document. Hello, Messi, are you still with us?
Hello, Joseph.
Yes, please.
There was a question from one of us who was asking about whether nutrition is a place in AfroPHC. I don't know if it was addressed, the question for that person. I saw it's in the chat.
I didn't see it, sorry. Okay. Does nutrition have any place in AfroPHC program? Well, the answer to that is yes. Nutrition has a place because if you look through that document, at every point, it's been mentioned that Africa should establish a PHC that is looks at the biology, looks at the sociology, looks at the physical, looks at the spiritual, and you cannot talk about the biological aspects of healthcare, especially with the increasing incidence of non-communicable diseases in the continent. At the moment, we're dealing with communicable diseases. Whilst we're dealing that, the non-communicable diseases is the hidden part of the problem. So we have at least 2 or 3 WAMIs facing us in the continent. So nutrition is very important, especially when you're talking about prevention, which is a major component of primary health care. You really cannot be talking about that without looking at proper and adequate nutrition for the population and our patients as well. So yes, nutrition has a key place. There are several mentions of nutrition in the draft document. So I do encourage all of us to look at it, please.
I'm sorry, Joseph, I had to take a very urgent call.
Thank you.
And yeah, I dropped off for a minute there, sorry.
That's okay.
But I'm back.
Okay, you're welcome.
Yes.
We've finished with Sinkere's presentation. I wonder if if you can take us on the next steps to this document. What is going to happen next?
Okay, all right. I don't know if people have mentioned what they like about the document, what they don't like, or what they would want to see included. I had you mention something on nutrition.
Yeah.
Is mentioned in the document.
Yes. We're not having a lot of interaction from our
yeah, because probably people are yet to interact with the document. That's all right. I've put a direct link to the document on the chat.
Yes.
So you can go directly to the document and actually add your comments there as you read.
Exactly.
So please do so because we will be finalizing on the document soon. As to the next steps, we have Prof. Shabira, Executive Coordinator, handling the writing of the document and the editing. So he and his team who are helping him are in the process of finalizing the final draft document that we are going to discuss during the workshop in South Africa in October. So that is the next steps with the document. So please get in your comments when you can, so that whatever you think you need included in the document is included in the document. And now from here, next is how do we take AfroPHC forward within the region? Because one thing that is important for us as AfroPHC is that we engage more with our members, both at regional and also country level. That is why it is important, one, register as an AfroPHC member on our website so that you can get communication on what is happening within AfroPHC, the various opportunities for capacity building and training, and also the various meetings that we are having and we will have in future. So please register so that you can get that information. Then I would also like to ask those in the meeting if there is anyone who would like to participate or to take a lead and also support Joseph as interim task team member for the region. Please feel free to speak up now, and Joseph will be in contact with you so that you can discuss as we move forward how to take the region forward in terms of engagement with AfroPHC and also as a regional chapter. Anybody with any comments, questions, concerns? Please feel free to just raise up your hand and unmute.
if you're still considering whether to be part of the task team, feel free to get in touch even after this meeting. But I think it's very, very important because quite often we as health workers, we have opinions. We feel that PHC is not being properly organized or properly run or properly delivered. But we should also take some personal responsibility when there is a move for the PHC to be improved wherever we are. So I want to encourage us. I know everybody is very busy. Your intro is very full, but just this one extra one will not kill you. Let me say that. You can always find time for it. And the tax scheme program can be scheduled in such a way that it's not overbearing on your time. So please feel free to recommend yourself or volunteer for this work. It's crucial. We cannot expect changes to be made to how PHC is delivered in our sub-region unless we speak up. And this is an opportunity, it's a platform, a very good platform for us to speak up, and not just speak up in our sub-region, but to speak up across the continent. So if you don't, if you're still going to think about it, you don't want to put up your hands now, feel free, please, to communicate and let us know, even after this meeting. Okay. I think in the absence of any hands going up, I will just leave it at that, and we'll bring the meeting to a close unless there's any other point that anybody wants to make before we draw the meeting to a close. But please, as has been mentioned repeatedly, click on the link to the draft policy document, go through it. It took me less than an hour, frankly, to go through all of it, and make your comments. Feel free to make comments. If you don't speak up, then your ideas will just remain with you alone. It is important that we speak up, and this is an opportunity for us to do that. And belong to an organization that is very vibrant. You can see from the presentation that both Mercy and Sinclair have made, that it's a very active organization. So please try and join and make your comment, make your views known. In the absence of Tijani Husseini, I can see your comment there. Thank you very much for the presentation you said as well. And I hope you have heard what Mercy said and what I have said as well. We need to form a West African task team to drive this project to a successful conclusion in our sub-region. It's happening in South Africa, it's happening in the South African, Southern Africa, it's happening in Central Africa, it's happening in East Africa. West Africa cannot stand by and just watch. Okay. So what's left for me now is to thank Mercy for the participation in this meeting, to thank Cynthia and Sinclair for their participation as well, and to thank all the rest of us who are here. We started with meeting only about 7. We're closing at 13 participants. At the point, we were up to 14 participants, but somebody had to leave. Peter had to leave for the other meetings. So it's not a very encouraging start, but we cannot give up. We cannot give up. We're health workers, and so long as we remain health workers, I see it as a personal responsibility that we have to move forward and get our leaders to take primary health care to the level where it should be, not only in West Africa, but across the continent. So once again, thank you who have made time to be here today. And I hope you found it useful. I hope
Yes, Joseph.
Yeah.
Yes, I've just one message.
Yes.
Joseph.
Yes, go ahead. Message.
Yes, I just want to thank everybody who is here. And at the same time, I would like to invite you, all of you, next week on the 16th. There will be discussions within the Southern Africa chapter. Please join us so that we can share these ideas and can help each other to improve primary healthcare in the region. I'm inviting you to the Southern Africa chapter Friday next week, same time. Thank you.
Thank you very much.
And sorry, Joseph,
I can see a message on the board.
One more thing that I
go
forgot. We are taking case studies for different primary healthcare teams that we have. So if you have an example of how you formed a primary healthcare team where you work and how you used to work, please go to our website. There's a place there which will give instructions on how to submit a case study. There is a prize of $1,000 up for grabs for the best case study. So please submit. So that there's $1,000 in prize money for 3 best case studies. So please submit your case studies as well. Sorry, Joseph, over back to you.
Thank you very much. Thank you. That's I just noticed on the chat that Tijani Oseni has volunteered to join the task team. So Tijani will get in touch with you. There is still room for others, please. Thank you very much once again, everyone, for joining this meeting today. And that's the end of this meeting. Thanks a lot, and have the rest of the day going well for you, whatever is left of it. Thank you.
Thank you so much, everybody.
Thank you.
Bye-bye.
Thank you.
Bye-bye.
Bye. Bye, everyone. Bye-bye. Bye-bye.